Good afternoon, everyone. This is Saro Arakinias, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Make sure to subscribe to the channel to receive daily notifications on medication news and updates. So, what is Tepezza or teprotumumab? Tepezza or teprotumumab is an insulin-like growth factor 1 receptor inhibitor indicated for the treatment of thyroid eye disease. I've included the picture of the vial over here for you to see. For Tepezza, it's obviously an injection. Teprotumumab mechanism of action in patients with thyroid eye disease is still unknown, but however, it's believed to bind to IGF-1R and block its activation and signaling. It's obviously for injection. It's a 500 milligram lyophilized powder in a single dose vial for reconstitution. The initial dosing is recommended to be 10 milligram per kilogram for first infusion, and then followed by 20 milligram per kilogram every 3 weeks for 7 additional infusions. Infusion reactions includes if it occurs, you should interrupt or slow the rate of the Tepezza infusion and use appropriate medical management. Exacerbation of the pre-existing inflammatory bowel disease might occur. Monitor the patients for pre-existing IBD symptoms or flares, and if it happens during the therapy, discontinue Tepezza if it worsens. Hyperglycemia may happen. Assess patients for elevated blood glucose and symptoms of hyperglycemia prior to the infusion, and continue to monitor the patients while they're receiving their Tepezza. Also, you may encounter hearing impairment, including hearing loss. Tepezza may cause severe hearing impairment, including hearing loss, which is in some cases may be permanent. Some of the common side effects seen from Tepezza or teprotumumab includes diarrhea, fatigue, hyperglycemia, hearing impairment, and dry skin. Again, this is a summary information about Tepezza or teprotumumab, which is an injection of 500 milligram powder for reconstitution, as you see in the image over here. It's a growth factor 1 receptor inhibitor for treatment of thyroid eye disease. The initial dose, as mentioned, it's 10 milligram per kilogram to be followed by 20 milligram per kilogram every 3 weeks for 7 additional infusions. Some of the infusion reactions, as I mentioned, they may include worsening the irritable bowel syndrome symptoms. It may cause hyperglycemia. So in these patients, taking Tepezza, the blood sugar levels should be monitored before infusion and also during and after infusion. It may also cause hearing impairment. In some patients, it may be very severe and it may be permanent. So again, it's something to be monitoring very closely. And again, some of the side effects that has been seen most commonly from Tepezza includes nausea, alopecia, diarrhea, fatigue, and hyperglycemia. So this is a summary information about Tepezza, teprotumumab for thyroid eye disease. For more detailed information on this drug, refer back to the package insert, which will give you more information on the dosing, cautions, precautions, and side effects on this medication. Hope you enjoyed this video. As always, stay safe and take your medications.